Our beloved speaker for today has an exceptional career in the field of medicine and was blessed with a great depth of experience in this profession for over 32 years. She was designated as the DOH Chief of Hospital at the National Center of Geriatric Health and a Family Medicine Geriatrics Consultant at GMF Hospital. Our respectful doctor is an active member of the Church of God Dasmariñas and an alumna of the Haggai Leadership Training in Maui, Hawaii. As a wife, she has been a source of strength and support to her husband, Jalasio L. Barzaga Jr., who is the hospital administrator at Juliana Melina Francisco Hospital. They were proud parents of 3 successful children, namely Jillian T. Barzaga, an ENT specialist, Melina T. Barzaga, an internal medicine senior resident, and the youngest, Frankie Barzaga, an entrepreneur and culinary arts graduate. Ladies, we are so privileged to have God's messenger in our midst today. Please join me in welcoming our dear speaker, Doctora Milagros V. Trinidad Barzaga.
Thank you very much for that very kind introduction, and good afternoon to everyone. Thank you for inviting me to be your speaker for today's lecture on actually women's health or healthcare among women. So thank you very much sa ating ladies ministry. Okay, so ang ating pag-uusapan ay about healthcare among women. Okay, so ang healthcare po or sa Pilipino ay pag-aalaga ng kalusugan. So ano po ba ang health? Health is a state of complete physical, mental, emotional, social, and spiritual well-being, and not merely the absence of disease or infirmity. So, ibig sabihin, kompleto po yan. So, hindi lang po may sakit ang tiyan or masakit ang ulo, kundi dapat po ay wala tayong depresyon, nasa maayos na relasyon tayo sa ibang tao, emotional, dapat tayo maging maayos o maging masaya, and spiritually maganda po yung relasyon natin sa Panginoon. So napaka-holistic po yung definition ng health. Next slide please. So sabi nga sa 3 John 1:2 sa King James Version, Beloved, I wish above all things that thou mayest prosper and be in health even as thy soul prospereth. In New King James Version, sabi, Beloved, I pray that you may prosper in all things and be in health just as your soul prospers. Ito po yung 3 bagay na pinagdadasal ng ating one of the apostles, John the Evangelist, sa kanyang mga followers and all the believers during his time, na hindi lang po yung pagiging yung pagkakaroon ng masagana sa material na bagay, kundi sa physical health natin and even yung ating soul, yung kaluluwa natin na maging maayon sa ating Panginoon. So, kailangan din yung relationship natin sa Panginoon. So, next slide please. So, these are our objectives for this afternoon. Number 1, to inculcate the importance of healthcare in the believer's life. Number 2, to discuss the different ways on how a woman servant of God should take care of their health. and to encourage the ladies to take care of their health as they take care of their soul. So next slide, please. So, ano po ba yung mga importance of healthcare? No, one, to be able to minister or share the word of God to our family, to our neighbors, especially those who are unbelievers, no? And of course, syempre kung maging malakas tayo, may magandang health tayo, nagagawa natin ito. Even taking care of our people aside from our family, in service to our fellow men, country, and God. In other words, at ating community, pwede tayong makatulong sa mga activities sa community. To be efficient and strong in carrying our duties and responsibilities in life. Lalo na tayong mga kababaihan as mothers, magagawa natin ang tungkulin natin sa ating pamilya. Diba? Kung malakas tayo, meron tayong good health, we can do our duties without any problems. No? So, also, to be a good example of being a good steward of health as a gift from God. Alam naman natin na ang ating kalusugan, bigay ng Panginoon na kailangan maging napangalagaan natin. It is a gift, di ba? And our body is the temple, no? A temple of God. Okay, so to be able to avoid diseases that may drain family resources. Alam naman natin na pagka nagkasakit tayo, magpapadoktor, magpa-hospital, gastos. So para maiwasan ang gastos at hindi magalaw ang ating savings na inilalaan natin para sa pamilya, para sa edukasyon ng ating mga anak. So next slide, please. So what are the ways on how a woman, as servant of God, could take care of their health? So ito yung ginagawa natin ngayon as health providers. No, we can give health education to others. So kung sana, hopefully, yung maibabahagi kong health education or information, kahit maliit man po, ay pwede nating ibahagi sa ating mga kapwa believers and even to others, no? Para sila din ay magkaroon ng good health. And then through disease prevention, so na-mention kanina, sa ating mga sisters, marunong silang mag-exercise. So, it's one way of preventing diseases, no? So, ito yung mga maipamahagi ko sa inyo, though hindi complete, kasi yung oras natin ay limited lang po. And then, to be a good steward, no? So, dapat pangalagaan natin ang ating sarili sa pamagitan ng taking care of our own health. And we can also take care of our own family. So health education, marami pong tatlong bagay po na level. We have primary level, secondary level, and tertiary level. Pagka primary po, ito yung mga preventive behaviors such as having a balanced diet so that we can protect ourselves from developing diseases in the future. Uso po ngayon na napopromote natin po yung whole plant-based diet na alam niyo po sa studies ay proven to reverse other diseases like for example diabetes. No, kung mag-stick lang tayo sa ating diet na full plant-based diet ay mari-reverse yung diabetes. So kailangan lang po disiplina. And syempre kung wala tayong disiplina, dapat ipag-pray natin para bigyan tayo ng Panginoon para magkaroon tayo ng will at saka yung magawa natin na mag-adhere sa full plant-based diet. Yung secondary level po, ito po yung to educate, to visit our health center when we experience symptoms such as fever, headache, para maaga pa malunasan na kaagad to prevent mga complications. No? Next slide, please. So, yung tertiary level naman po, ito po yung may mga sakit na, but we still have to educate them to take their medication properly and ways of working towards rehabilitability. Okay, ito unstable na ba? Okay, so kailangan po natin na i-maintain pa rin yung health nila by example, stroke, kailangan natin ipa-physical therapy para maiwasan po yung complications or deterioration ng kanilang health para ma-stabilize po. Then, mas i-retrain po natin, iba po kasi ang pag-i-educate kung meron nandun na yung sakit. Kailangan i-emphasize natin mabuti na kailangan mag-exercise sila and to properly adhere to their medicines. Okay, and to their proper diet. Next slide, please. So, ano po ba itong mga sakit na ito? Kagaya ng mga chronic diseases like diabetes, cancer, heart diseases, and dementia. Lalo na sa mga age group na elderly, mahirap po mag-educate, no? So we have to include their caregivers. So, which means na patient education are more complicated in this age group because meron na silang age-related problems. Like for example, hearing impairment or visual impairment. So, kailangan natin matutukan. Okay, next slide please. So, mapunta po tayo sa disease prevention. So, ang treatment na ito po ay intended to prevent a disease from occurring or worsening. Adult people with minimal or no chronic disease and even older patients with several irreversible diseases may benefit from preventive measures like stroke. So next slide, please. So we have three types of prevention. We have primary, secondary, and tertiary prevention. When we say primary prevention, it refers to efforts to eliminate health or functional problems at their source. It prevents the occurrence and reduce the incidence of disease. Like primary prevention like immunizations, nutrition, exercise, and emotional well-being. Next slide, please. So, ano po to ang mga immunizations na kailangan natin? So, we have flu. So, ito po ina-emphasize namin or natin na napaka-importante sa mga immunocompromised patients. Like kagaya ng mga elderly, 60 years old and above. And it is being given once a year. So, ina-advise po namin na pagka magpakuna tayo, kailangan before the rainy season. Like, ito ngayon, May or April, dapat nagpapabakuna na tayo ng flu. Kasi during rainy season, doon po yung mas marami nagkakasakit. Kasi because of the decrease or yung temperature o malamig, mas prone tayo sa pagkakaroon ng viral or bacterial infection. We also have a pneumococcal vaccine. That is being given every 5 years, pero pagka nasa edad tayo ng 65 years of age, kahit isang beses na lang po. And then we have herpes zoster vaccine. Ito po yung binibigay natin na vaccine para maiwasan natin yung mga makirot na sanhi ng pagkakaroon ng herpes zoster. Usually being given also to our elderly patient para magkaroon sa kanila or magkaroon sila ng quality of life. No, na hindi sila nagkakaroon ng nararamdaman na kirot. Kasi once na magkaroon ka ng herpes zoster, napakakirot po kahit gumaling na. After 1 year, mararamdaman mo pa rin. Okay, so we also have tetanus, diphtheria, pertussis. Isang injection lang po na kailangan. And then yung COVID-19 vaccination na alam naman natin po na noong wala pang bakuna, naku po, kahit doktor, nurses, ay marami pong nawala o namatay dahil wala tayong panlaban. So napaka-importante po na meron tayong mga bakuna. So nagbibigay ito po, di ba? First dose, second dose, and the third dose is the first booster dose. And ngayon magkakaroon na pa tayo ulit ng second booster. So next slide please. So sa nutrition naman po, older adults are at great risk for malnutrition, which can lead to a number of serious health problems. So, importante lang po na unahin muna natin ang pagkain. And sa ating mga nakakatanda, ina-advise natin na eating small but frequent, high energy, high protein snacks and meals. And it is the first treatment option for elderly people who are malnourished. And then nutrition support is recommended for malnourished people who are unable to maintain body weight by food intake alone. So, yun po ang role ng mga nutrition support like milk formula, and then oral nutritional supplements, ang dami naman po na naglalabasan ng mga food supplements, no? Pero dapat isipin natin na hindi po tayo mag-rely sa supplements alone. Kailangan kumain pa rin tayo ng 3 beses, and then on top of that, pwede po tayo magkaroon ng oral nutritional supplements or in-between meals. So next slide please. So, sabi kanina, one of our sisters was very active in Zumba, no? So totoo po yan. Because studies suggest that physical exercise has value in primary prevention of heart disease and death. Ito po ay pagka hindi tayo nag-exercise, yun, yung sedentary lifestyle is a risk factor as significant as hypertension and smoking. So kapantay lang po ng may high blood at naninigarilyo yung tao na hindi nag-exercise. Okay? So primary intervention of regular physical activity throughout a person's life can potentially reduce the likelihood of acquiring Alzheimer's disease. So imagine po, exercise lang ay nakaka-prevent na ng Alzheimer's disease or dementia pagka nag-edad tayo. So ito po, pwede tayong mag-exercise 30 minutes a day, kahit every other day, no? Or 3 times a week. So next slide please. So emotional well-being po, napaka-importante din na maganda ang pakiramdam natin. So again, physical exercises, dancing and walking, ito po yung nagbibigay sigla sa ating mga seniors. At mag-exercise na rin para sa kanila, para to maintain clear minds and reduce stress. Okay? So also, yung mga home visits, napaka-importante din na madalaw sila, lalong-lalo na nung panahon ng pandemic, no? So, regular phone calls or video chats with family and friends. Hindi lamang po naman sa mga may edad, kundi sa ating mga mas nakakabatang kababaihan, no? So, caring for others is a good way for your loved one to boost his or her emotional well-being. Yan po ay ramdam ko po Once na malungkot ako, I find ways of making myself happy or nakakaramdam ng well-being or emotional well-being by helping others. No, pagka may natutulungan ka, pagka magiging kind ka sa iba, bumabalik po sa atin yung emotional well-being na pakiramdam. And it is a gift from the Lord. Diba po ba? Hindi po natutumbasan ng pera po yung nagbibigay ng kaligayahan pag ang Lord ang nagbibigay sa atin by blessing others. Okay? So, encourage spending time with grandchildren. So, di ba po, tayo na may mga, kayo, wala pa akong grandchildren, kayo na may mga apo, ayan po ay gift din ng Panginoon sa inyo para magkaroon kayo ng, para maging masaya kayo. Diba? So, even taking care of a pet, kung meron tayong pusa, aso, ay nakaka-improve din ng emotional well-being natin. So, next slide please. So, ito po yung mga daycare activities. Usually kasi po sa akin, ako as a geriatrician, ito po yung mga exercises. Pero hindi lang naman po sa mga elderly. Pwede rin po sa ating mga nakakabatang kababaihan. No? So, kaya naman po, ang na-emphasize ko lang pagka elderly, low impact exercise. Hindi po yung mga patalon-talon na lang na hindi nila kaya. Yung medyo hindi heavy. Yung simple lang na exercise. No? So, yung low impact exercise na kahit nakaupo tayo, pwede pa rin mag-exercise. Wala pong hadlang. Kahit sabihin natin, ay meron akong arthritis, hindi ko kaya yan. Pwede pa rin po. Kailangan pa rin natin mag-exercise. Okay? So, we also have art therapy. So, kagaya ng painting. Napakasarap po ng feeling na kung minsan nagpipaint tayo, nakikita natin, ay, ang ganda-ganda. Kahit simple lang po. So, and then we have music therapy. Of course, Christian music. Christian music can soothe. Diba? And even parang sumasarap po ang pakiramdam natin pag nakakinig tayo ng music. No? Kahit anong klaseng music na maganda para sa ating pandinig. Yung mga what they call instruments, guitar or piano, and Christian music, ayan po ay masarap po ang pakinggan at nakaka-relieve ng stress. And Bible studies. So, ugaliin din po natin magkaroon ng regular Bible studies. I know this is not new to us. And talagang regular po sa ating mga kababaihan. So, thank God for being in the church, being with fellow believers. We also have handicraft making, no? Para to keep us busy. Okay, sometimes nadidepress tayo pag wala tayong ginagawa. So, yung na makakahiligan natin na mga handicraft, let's say kung mahilig kayong magpurda, so pwedeng yun ang gagawin natin, lalo na yung mga kababaihan na retired na, no? Then, health lecture series. Sa mga ganitong mga may lay forum, pwede din tayong makinig. And also, especially in the church, marami tayong maririnig na mga lectures, no, about God, diba? About the love of God. And then, movie viewing. So, sa mga may edad na, yung mga mas gusto nilang pakinggan o panoorin yung mga movies during their time. Okay? And then picnic and day tour. No? Okay. Next slide, please. So let's go to the secondary prevention. It involves efforts to detect adverse conditions early in their course and to intervene promptly and effectively. This is to curtail the spread of disease to others. No, and these are mostly mga screening tools that identify diseases in the earliest and lead to early diagnosis and prompt treatment of disease, illness, or injury. So next slide, please. So, para sa ating mga kababaihan, no, we have 6 essential health screening. So marami po ito, pero ito lang yung na may mention ko. Number 1, yung mammography. Ito po ay X-ray to test for breast cancer. No? So, napakalaga po na magkaroon po tayo ng mammography, especially those who are at risk. Yung mga may history po sa family. Okay? So, it can be done as early as 50 to 54 years of age. Pero kung at risk po, meron kayong history ng cancer sa family, mas maaga po at 40 years of age and can be repeated 1 to 2 years after. Okay? So, yung pap smear naman po ay ginagawa to detect new cell growth sa ating cervix na pwedeng mag-lead to or can cause cervical cancer. Okay, so usually it can be done 21 years of age and above. And okay, so it can be repeated every 3 years. Okay, so yung HPV naman po, or your human papillovirus test, ay usually this virus kasi po, yung HPV virus can cause cancer. So kailangan po din ma-screen tayo para ma-prevent yung pagkakaroon ng cervical cancer. And it can be done at 30 years of age to 65 and then every 5 years. Actually, meron po tayong bakuna para dyan. And mas maganda po na maibibigay yung bakuna for HPV at the earlier age sa mga teenagers. Okay? So, we also have lipid profile test. Ito po yung mga napapaloob dyan, yung triglycerides, cholesterol, HDL. Ito po yung HDL. Ito po yung tinatawag na good cholesterol because it protects the heart. And then we have the LDL or the light density lipoprotein and the VLDL. So, ito po ginagawa, sabihin ng doktor natin na ito fasting. So it needs a 10-hour fasting before you can request for the lipid profile. Okay? So and then the blood pressure screening, kailangan din po natin alamin kung high blood tayo or normal yung blood pressure natin. Pagkuha ng blood pressure, kailangan po before eating. Kasi pagka after eating, mababa po, generally mababa po yung blood pressure natin. And it does not reflect the true value of our blood pressure. And you can get 3 monitoring, and then you can get the average. So that is your blood pressure. Okay. Then we should screen also for colon cancer. No? And yun po, initially pwede nating i-request yung fecal occult blood test. No? So mag-submit tayo ng konting sample na ating dumi, then and then and then have it test sa laboratory. Pero meron pong procedure dyan na dapat 3 days before, kailangan walang red meat, walang raw vegetables before before the test. So 3 days po yan na preparation. Okay, so we can also, after that, we can also request for colonoscopy. Lalong-lalo na po yung may mga history sa family na colon cancer. Okay, so ang colon cancer, we can start at the age of 45 years of age. And then for the bone density test, yung DEXA, a test for osteoporosis, merong yung scores po yan na equivalent kung mababa na or may osteopenia na yung score mo or severe na po. So, maganda po na i-test natin lalong-lalo na sa mga 50 years and above. Okay? Para ma-prevent natin yung fall. Kung osteoporotic na tayo, mas chances na magkaroon tayo ng fall and we can have fracture. So, kailangan natin ma-prevent yun para at least hindi tayo magkaroon ng operation or bali. Okay, next slide please. So, sa mga elderly naman po, ito yung mga screening tools na ginagamit namin. Pero pahapyaw lang po kasi masyadong technical na rin yung ipapakita kong next slides. So ito yung functional status, ito yung mga screening tool na ginagamit namin, yung mga activities of daily living. Ito po yung pag na-test po natin ito, malalaman natin kung kailangan na ng caregiver si Lola, kailangan ba niya ng part-time caregiver or full-time caregiver kung masyado na siyang dependent, lalo na yung mga stroke na patients. So, then next is the MNA or Mini Nutritional Assessment. Itong tool na ito, malalaman natin kung malnourished ba ang patient natin or at risk or mild or moderate para magkaroon tayo ng intervention na bigyan ng tamang nutrition si Lola or ating mga younger adults, no? So, meron din po tayo yung tools na ito, geriatric depression screening at the age of 60 at meron na hahalata natin na malungkot ang ating kasama sa bahay. Dapat alamin din natin, baka meron na siyang depression. Kasi maimportante na malaman natin bakit. Kasi pagka may depression tayo, mas mahirap tayong gumaling kung kinapitan tayo ng sakit, na physical na sakit. Let's say, nagkaroon tayo ng pneumonia o kung depressed si Lola, mas matagal, mas mahirap gumaling kung may depression siya. Okay, so we have MMSE. Ito yung Mini Mental Status Examination. Ito yung tool po na ginagamit namin usually to screen kung may dementia or Alzheimer si Lola. Again, urinary incontinence, ito naman po yung nakakaihi sa salawan. Meron po din tayong screening. Kailangan alamin natin bakit kaya umihi-ihi sa salawan si Lola. Hindi lamang po dahil meron siyang dementia, kundi pinaka-common na cause of urinary incontinence ay meron pong urinary tract infection si Lola. So, kung meron tayong napansin natin na may nakakaihi sa salawan, ipa-examine natin ang ihi. Baka merong infection. Nang sa ganon, malunasan na natin, mabigyan na natin ng tamang gamot or antibiotic. Okay? So, yung gait and balance naman po, meron po din tayong screening test dyan, yung time up and go test. Ito para malaman natin kung prone ba si Lola na matumba. Kasi kailangan natin ma-prevent yung fall para ma-prevent yung fracture at ma-prevent ang pagkaka-ospital at pagkakagastos. Okay? So, next is the sensory impairment. Meron tayong screening tool para dyan. Yung visual and hearing. No? So, meron tayong, yung sa visual, may pahapyaw po mamaya sa next slide. Next slide, please. So, ito po yung para ma-test natin yung visual impairment. Usually, yung Snellen chart, hindi lang naman po sa matatanda, kundi younger adults, no, younger mga individuals. Ito po kahit sa mga drivers, ginagamit po para ma-test kung may problem sila. Okay? So, ito po, kung hindi mabasa, let's say, ang pasyente natin sa 20/40 line, nandito po yun. Okay? So, siya ay may hearing impairment na. So, kailangan natin malaman kung bakit. Pwede nang pwedeng merong katarata, merong sanhi ng diabetes. In that way, malulunasan pa natin. Kasi napakaganda ng may maliwanag or nakakakita ng maayos para nakikita, ma-appreciate mo yung environment mo. At saka magkakaroon pa yung quality of life ng isang pasyente natin o ang ating mga nakakatandang mga kasama sa bahay. Okay? Next slide, please. So here, impairment po ay usually ginagamitin namin ng whispered voice test. Pero once na dumating ang patient ko na 60 years old and above, alam ko na kasi pag nag-uusap kami, nararamdaman ko na kung hindi niya narinig ang sinasabi ko, baka may problem sa hearing. So, pwede rin, kailangan na rin natin ma-address, no? Ipa-check na rin natin para mas naririnig tayo at maging komportable sa conversation. Next slide, please. So, ito po yung whisper test na tinatawag. Pero technical na po ito. So, pwede rin natin magawa sa ating mga patients yan or sa ating kamag-anak sa bahay. Next slide, please. So, yung sinasabi ko kanina, yung urinary incontinence, pwede lang may screen by asking these two questions. In the last year, have you ever lost your urine and gotten wet? Or number 2, have you lost urine on at least 6 separate days? So, yun po, dalang questions lang po yan. At pag sinabi niya na yun nga, ihi siya sa salawan, at pwede natin i-test yung urinalysis para to confirm kung meron siyang UTI or if other, marami naman pong sanhi ng pagkakaroon ng urinary incontinence. No, lalo na yung mga kababaihan na maraming anak, medyo mas loose na po yung mga muscles that controls the pag-ihi or urination. Next slide, please. So, ayun po, meron pong tinatawag na urge incontinence. Yung hindi po nakakarating ng CR, nakaihi na. Yun yung urge incontinence. Yung stress incontinence po naman, yung umubo, ay napapaihi na rin po. And then yung overflow incontinence, usually sa mga kalalakihan natin na malaki yung prostate, kaya yun ang cause ng incontinence. So, napaka-importante po na magpatingin din tayo sa doktor. Or the first thing that we can do pa-examine natin yung ihi nila. Tingnan natin kung meron silang urinary infection. So, next slide, please. So, yung malnutrition or weight loss, ito po, common po sa mga lola, lolo natin na and it is common comorbidities at higher risks for malnutrition. So, yun nasabi ko kanina, we can use the MNA or the mini nutritional assessment. And kung depende po yung score, then we can intervene and ask your doctor kung ano po ang kailangan ng mga importante na ibigay natin na pagkain. Okay, so yun po. And also, meron po na tayong nire-request din na mga laboratory workup. Like for example, yung serum albumin. Pag mababa po yan, ibig sabihin mababa po ang protein natin sa katawan. Kailangan po natin magdagdag sa pagkain para meron tayong adequate na protein sa katawan na panlaban pag nagkaroon tayo ng sakit. So remember na ang protein kailangan sa repair ng tissues. Okay? So ito po yung mga nire-request namin, CBC, serum albumin, yung serum electrolytes, lipid profile, and others. Basta kailangan ng pasyente i-request natin. Next slide, please. So ito po yung strength, balance, and gait impairments. So meron po tayong ginagawang procedure para ma-detect natin the presence of lower extremities, body weakness. So, yan po. So, next slide, please. So, ito yung gait. Ito yung gait, yung paano ba ang Tagalog ng gait? Yung paano yung maglakad yung patient. Ask the patient to walk 12 feet at his or her own pace, turn and return without stopping. Task can be repeated with the distraction of counting backward from 20 while the patient walks. Ito po yung malalaman natin, yung disparity ng gait, ay malalaman natin na merong pwedeng mahulog o pwedeng siya ay prone sa fall. So kailangan bigyan na natin ng sandata ang ating nakakatandang pasyente. Kaya meron tayong cane, meron tayong yung anong tinatawag nun, yung walker. Okay? Next slide, please. So, isa pa sa mga common sa nakakatanda ay yung dementia. Ito po ang diagnosis or ito po yung definition ito. Pagkakaroon ng memory impairment plus one of the following. Yun yung may language disturbance or aphasia, apraxia, difficulty in motor activities, nahirapan na po siyang maglakad, agnosia, inability to recognize objects. Kaya kahit simpleng ballpen lang, hindi niya ma-identify or watch, hindi niya ma-identify. And then disturbance in executive functioning, planning or organizing. So hindi na siya, nahirapan na siya mag-plan. Okay? So ang ginagamit po natin na pang-screen po ay ang tinatawag na MMSE or the memory test po yun. Ito po yun. So it includes orientation. Meron tayong tanong. Example of mga tanong na sa orientation. Lola, saan po pa kayo? So tatanungin natin kung nasaan siya. Or ilan taon na siya. So, ang may patient na may dementia, hindi po niya masagot. Parang hinuhulaan niya kung minsan. Sabi niya, 23, 24, ganun po. Pero kung ang pasyente ay nasa tamang pag-iisip, na kahit 95 na siya pa rin ang memory, pag tinanong mo yan, magagalit pa sa iyo. Kaya, ano po, usually, yung mga talagang may problem sa memory at ito po yung ginagamit nating paraan para matest. Screening lang naman po ito. Pwedeng maging normal, amnestic, mild, moderate, severe. Next slide, please. So ito po yung sinasabi ko na depression. Huwag nating babaliwalain kung medyo malungkot si Lola. Huwag nating sabihin na ay ano lang kasama sa pagtanda. No, hindi po. So ito po yung mga katanungan na pwede nating gamitin. Have you often been bothered by feeling down or depressed? Kayo po ba ay nalulungkot? Oo o hindi. And then, sa mga nakaraang buwan, kayo ba ay nawalan ng interes sa dati nyong ginagawa o sa dati nyong hilig? Oo o hindi. So, kung positive ang sagot sa isa sa dalawang yan, pwede po nating meron pa tayong mas mahabang test, 30 or 15 item version. Okay? So, next slide please. So let's go to the tertiary prevention. No? Tertiary prevention aims to reduce complications of disease once established. Ito yung may mga sakit na talaga, may diabetes na talaga. So, or may stroke na. Okay? So, hindi man po, nandyan na, kailangan pa rin natin ng tertiary prevention. Ito po ang aim natin ay to aims to soften the impact of ongoing illness or injury that has lasting effects. Ito para maiwasan ang mga complications at deterioration para hindi na lumala. Di ba po? Pagka halimbawa ang stroke mo ikalahati lang, kailangan natin ng ma-exercise, magkaroon ng physical therapy para hindi lumala or ibig sabihin baka ma-include pa yung kabila, di bedridden na siya. So yun po yung tertiary prevention. And examples of this, next slide please. So ito po yung may cardiac or stroke rehabilitation programs, chronic diseases like diabetes, arthritis, and depression. Ang diabetes po, sabi nila reversible na po pag ang strictly on whole plant-based diet. Pero pag may edad na po, ay mahirapan na pong bumalik. Di po ba? Pero at least mas mababawasan natin. So pwede pa rin natin i-modify yung diet nila na mas may more on vegetables. Pero yung kahiligan nila na pagkain, siguro bawasan natin ng karne. Kasi kung ayaw naman nila ng vegetable, wala tayong magagawa. Para hindi, meron kasi tayong tinatawag na quality of life. Kailangan yung nalalabing, yung buhay nila, ma-enjoy naman nila. No? That's quality of life. So, meron din po tayong mga support groups that allow members to share strategies for living well, and then vocational rehabilitation programs to retrain workers for new jobs when they have recovered as much as possible. So, next slide please. So, ito po, in-include ko ito yung sa nursing home. Kasi sa ating mga Pilipino, hindi po uso na dadalhin natin yung mga kamag-anak natin sa nursing home. Pero sa ngayon po, dahil mas kokonti yung, kasi yung mas kokonti na po yung mga anak natin, and usually yung mga anak natin nga pumupunta sa abroad, wala tuloy mag-alaga sa ating mga nanay o mga lola. So, pwede po natin din dalhin sa nursing home na sila ay maalagaan. Kasi kung hindi tayo pwede, tayo ay pumapasok, mas maganda na may titingin sa kanila. At the same time, maiiwasan din natin yung caregiver burden. Ika nga, kung tayo na nagtatrabaho pa, tapos pagdating ng bahay, tayo pa ang mag-aalaga, mas maigi na yung ipaalaga natin sa nursing home. Kung available, kung kaya po ng ating budget. At the same time, pwede pa rin natin madalaw si Lola sa nursing home. At the same time, nakakapagtrabaho pa tayo. Ito po yung aming yung hospital ngayon na we are catering for outpatient lang po sa ngayon kasi wala pang inpatient. We're still waiting for the license to operate from the OH. Pero ang dami na pong mga pasyente, 80 to 90 patients a day. So, meron din po tayong mas mga batang kababaihan or kalalakihan na pumupunta na being taken care of by the family physician. Pero more on geriatric facility. Ito po yung National Center for Geriatric Health na sana po pinagpipray, sana pag-pray natin na magkaroon na po ng sariling batas. Kasi ang natin po sa government po, hindi po magfa-function isang hospital kung wala pang batas na manggagaling sa Congress or executive parang order from the President. Ito po yung mga, minsan may mga, ito ang gustong-gusto ng mga ating mga elderly, yung may mga programs, dancing, singing. Ito meron mga volunteers na pumunta doon para may free haircut. So, yan po. Salamat po ng marami. And sana po meron kayong natutunan.